women are relieved to not have a period for the duration of pregnancy and for at least the first few months of breastfeeding. But what is not commonly talked about is the 4 to 6 weeks of postpartum bleeding and discharge that occurs after birth, otherwise known as the lochia. The lochia looks bloody at first, which is why it is sometimes referred to as the postpartum bleeding. However, lochia is made up of more than just red blood cells, and it is also not a menstrual bleed. So, let's talk about what lochia is, what the first 4 to 6 weeks looks like for fertility charting postpartum as you wait for lochia to resolve, and when to contact your doctor if your postpartum bleeding seems abnormal.
What is postpartum bleeding or lochia and how long does it last? For 9 months, give or take, your baby has been living in the womb, swimming around in amniotic fluid, thanks to high level of estrogen and progesterone. The endometrium or the wall of the uterus has been building up a nice, thick layer of blood, placental tissue, endometrial lining, and the mucus. So after the baby is born and the placenta is delivered, there is still a heap of tissue known as lochia that needs to clear the uterus regardless of whether you delivered your baby vaginally or C-section. But unlike the baby and the placenta which come out whole at all at once, the residual tissue is gradually sloughed off over time, ranging between 4 to 6 weeks. When the placenta detaches from the wall of the endometrium, an open wound called the placental site is left, and it can be up to 8.5 inches in diameter. To give you some perspective, that is the size of a dinner plate. So not only in a new mother going through the bleed of all bleeds during this time, but her body is also working to heal this open lesion in the uterus. This is just another reason why new moms should be doing very little but bonding with their new little one, resting, hydrating, and nourishing their babies and themselves. When new moms do too much, their flow of lochia often increases in amount as the placental site bleeds, slowing the healing process. When they are able to rest, lochia is often less, and healing can begin much faster. This explains why some women will see their postpartum bleeding stop and start again if they are too active in the early days of postpartum.
The first stage is the Lochia rubra. The rubra stage lasts for about the first 4 days after you've delivered the baby. The first stage is accompanied by the most cramping since the uterus is still shrinking back to its original smaller size. Many breastfeeding women notice that whenever the baby latches on, they almost immediately begin to experience lower abdominal cramping, also known as the menstrual cramps. This is due to the oxytocin rush that occurs with suckling and the milk. And also, many women may notice a gush of blood when they stand up after sitting. This is due to blood pooling within the vagina. During the rubra stage, lochia bleeding will be bright red and may also have some clots, but these clots shouldn't be big or difficult to pass. Clots are caused by pooling blood and occur in the first 2 weeks after giving birth, but not usually after. The rule of thumb is that anything larger than a golf ball warrants a call to your healthcare provider. The second stage is the lochia serosa. The serosa stage lasts about 10 days, beginning when postpartum bleeding transition from bright red to pink or even to brown. At this point, there are proportionately more white blood cells than red blood cells in the lochia, which is the primary reason for the change in color. During this time, the placental site is still healing but has made major progress in a short amount of time. The third stage is the lochia alba. This alba stage is the final and the longest stage of postpartum discharge. At this point, it may not even look like bleeding anymore. Lochia will be a yellow whitish color and consist of cervical mucus, white blood cells, and epithelial tissues. The placental site is rapidly creating a new skin tissue to heal, which result and more shredding of the tissue. When it's all said and done, on average, all three stages of Lochia last 4 to 6 weeks in total. But depending on the new mother's activity and stress level, it can go longer or shorter.
What does Lochia mean for postpartum sex and fertility charting? The return to fertility after giving birth is widely variable depending on a whole host of circumstances. Even for the same woman, the return to fertility can vary after each new baby. But in those first 4 to 6 weeks, most moms don't need to worry about ovulation happening if they are breastfeeding, or even pumping milk or mixed feeding. After those 6 weeks, it is restless, certain, depending on how you're feeding your baby. Between healing from a vaginal delivery or C-section, enduring sleepless nights, figure out feeds, and dealing a newborn's general fuzziness, fertility charting is usually the last thing a new mom wants to think about. Not to mention that, while there's no definitive timeline for a new mom is considered cleared for intercourse, the standard answer is about 6 weeks, but each individual is different and some may need more time. It's not typically very high on the priority list for new parents, so FAM instructor generally tell women not to stress about beginning charting again in a particular time during those first 4 to 6 weeks. You should simply begin charting when you either see cervical fluid after Lochia has cleared or when you find yourself even remotely interested in sex again. Being physically ready for sex is also different than being emotionally ready. A mom may not feel ready due to how the birth unfolded or the pressures of her new and chaotic life. Rest assured that the 6 weeks clearance from your doctor may not take into account all other variables, like emotional and psychological ones. Everyone has a different journey. Some women are ready to get 6 weeks, while others need more time, even months or more time.
There are also abnormal postpartum bleeding. The warning signs you need to know about when to contact your care provider. First, if a postpartum bleeding doesn't seem to be getting lighter each day. Next, if you feel more than one menstrual pad an hour. Next, if bleeding continues to be bright red and doesn't transition to brown or pink after the first 3 days. Next, if clots are longer than a golf ball. Next, if blood clots persist past 2 weeks. Next, if you have a fever, chills, aches, or a severe headache. Next, if you have a blurred vision, weakness, faintness, or dizziness. Next, if you experience abdominal pain not related to cramping that accompanies breastfeeding. And lastly is if you have a foul-smelling vaginal discharge. If you experience any of these symptoms, you should immediately contact your OB or midwife. Some of these symptoms may be indicative if the postpartum hemorrhage or infection, conditions that can be deadly if not treated promptly. Your care provider will be able to help you navigate which kind of postpartum bleeding is normal and which is not. Thank you.